people don't realize that there's so many connections. So one of the things I used to tell my new patients is read the book, and next time we talk about your life through the eyes of the virus. And inevitably it's like, oh my gosh, all these events that were unrelated in my medical history and my hiccups and here and there, mystery conditions, now I can track them. This is another layer of this virus. And so in medical literature, researchers say if you have idiopathic condition that doesn't, chronic idiopathic condition that doesn't respond, you don't know where it's coming from, you need to test for chronic activated EBV.
Welcome to the PEMF Effect, where breakthrough science helps take control of your health. I'm Dr. William Pollack, and I'm here to guide you in tapping into the power of PEMF therapy for recovery, vitality, and total body wellness. From overcoming chronic pain, optimizing brain health, boosting energy, and aging with strength, this podcast is your path to cutting-edge solutions for lifelong well-being. If you're ready to move beyond symptom management and tap into your body's natural healing ability, you're in the right place. Let's dive in. Today's episode was previously recorded on the Pain Solutions Summit that I hosted. So welcome today to another special episode of the PEMF Healing Summit. And I have a dear old friend who's with us today. And when I knew her, she did something very different. And then she moved on and became an expert in EBV. And so without me saying much about her, then let me ask Kasia, Dr. Kasia Kines. I call her Kasia. How do you want to say it? Kasia or Kasia?
Kasia. It's always Kasia.
Kasia is the Polish way to say it.
That's right.
All right. So Kasia, please tell us about yourself.
So it's so good to see you, Dr. Pollack. So we worked kind of together years ago. My name is Kasia Kines. I'm a doctor of clinical nutrition, and I am told I'm a global expert on Epstein-Barr virus. There's not enough of us doing that, that's for sure. So we have created amazing resources for people. So we have kind of a hub website with resources, all evidence-based for people online. We have consumer programs, I work really close with each student. We have practitioner trainings, we have practitioner mentorship programs. I have the book, and we keep going. I haven't finished yet. So our goal is, I'm a CEO of EBV Educational Institute and Global EBV Institute. So we hope to reach the first 1 million people with a message of hope, and then we're going to go from there.
Now you're being very modest. So Dr. Kines, when I knew her, was not a doctor. She was a nutritionist, and she was a superb nutritionist. I worked with her extensively as a nutritionist. I always like to refer people to her.
That means a lot to me.
She left the nest and went somewhere else and got her PhD. Tell us about your PhD.
I was looking for clinical functional nutritional PhD for many years, but couldn't find anything that was worthwhile. And then Dr. Lipski literally manifested a program like that herself, and she's a friend of mine and a mentor. And so she was in Maryland for a while. She connected with Maryland University of Integrative Health. They made it happen. She invited me to the forming committee, I think it was, and I just had to jump in the first cohort. So could not wait. So that's what we did. I just jumped in, and that forced me to really focus on EBV, writing the book, doing the due research, because otherwise, when you're in clinic, you never have time. You're in the trenches doing the work with patients, but you don't have the capacity to sit down and write and create protocols in a book.
Well, but for your PhD program, you have to become an expert in EBV. And I don't think that you were necessarily an expert in EBV before you started your PhD, right? So what did you learn? What did your PhD teach you about EBV that you didn't know before?
I actually was. The PhD, there was only one module on virology specifically with Dr. Vasquez. And that perked my interest so that actually helped, because that is how I was able to start creating more protocols. But it was only a little glimpse of it. He wasn't even focused on EBV. It wasn't enough. So basically, I was already working in the trenches with EBV and trying to figure it out and getting better and better. And the doctoral program forced me to write. I needed to find a final project dissertation, so to speak. So that's where I had to assign time to write, to go through medical literature, systematize it. And so that's the way the program helped me. And so once I had the 75 pages of documentation, everybody, including my husband and Liz Lipsky, was telling me, where are you going to write the book? And I said, what book? So this is 590 pages.
So let's see your cover, show your cover. So it's called the Epstein-Barr Virus Solution.
Yeah, so people change their lives with that book alone. So it's wonderful because doctors are recommending it to patients. Patients are buying it for their doctors. So it's just wonderful. It's just starting to, it has been doing its job. And so after this book, I started to create programs online to leverage and to have access to people live, because a book is limited. And supplemental protocols in the book, that was the scariest thing, because I always worry that people will misinterpret, overdo, overdose and hurt themselves. So, but that I have an entire chapter on protocols as well in the book.
Well, let's clarify something, because a lot of people surprisingly know EBV, and they don't necessarily even know what it means.
That's right.
Right?
Epstein-Barr virus. I think people know more about it now because of COVID. Because what happened with COVID, even Wuhan University started to do studies on COVID patients and then testing them for Epstein-Barr virus. Because it's one of those big viruses that likes to thrive when there's co-infections. This is why, for example, I tested myself last fall when I started to notice that I probably was reactivating my own EBV because of my repeated mold exposure, which is common in our community. So so with COVID, it came to light. We have a big study, a recent study on long haulers. And one study showed 73% of the group of long haulers actually had reactivated, and they tested properly, reactivated. So EBV is coming in the news right now. It's interesting because there's also a scary study, a big study on MS and EBV. So people literally come to me, they are scared that they're going to get MS if they have EBV. Well, we've had studies on MS. They're in my book. It's not something new, but I don't know why they're targeting this. They're scaring people. And then Moderna is coming up with a pilot study on vaccination for EBV at the same time. So there is this climate of let's scare the people. Let's get them to, plug into one way of looking at the solutions.
Well, but let's back up even more. The EBV has been around for forever.
Millions of years.
Yes, forever, right? So it's not new. And we used to call it mono.
Right. We still do.
And so kids get mono. So we say it's mono. But so people know it as mono, they don't know it as EBV. So if you had mono, then basically you have EBV.
Right.
Right? And you have it for life.
Yeah, so we most of us are born with the virus. It's 95% of global population has the virus. And that's the common knowledge in medical literature. And that's probably why the researchers have been working on global vaccination forever. But it's an opportunist, so you can have the virus. Like I never tested until last fall. And, and I had antibodies, we carry them, but it doesn't mean much if you're functional. It's only when you have opportunistic environments, changes in your terrain, infections, stress, poor diet, specific things that can trigger it. Yes. So
let's go into that. So this is a virus that's ubiquitous.
Right.
Right. As you say, we're born with it, or it's called the kissing disease, right?
The kissing disease, yes.
Right. Yeah. Adolescents get it. College kids get it. High school kids get it.
Yeah.
And so that's how we know it as mono. But as you said, most of us are exposed to it all the time. One of the problems that doctors have, and I found this myself, and I started digging into it, there's very, very little literature on EBV other than acute EBV. And most of the medical community ignores it.
Yeah, so it's actually not true that there's no literature, and that's why I had to write the book. So 1/3 of my book is literature. That's what I pulled. And And I have to tell you, I had to stop looking to finish the book, because if I looked at another condition, and I went to PubMed, I saw relationships. Another condition, very unlikely, more relationships. So at some point, I stopped doing research and published the book, because the literature is there. It's just that, somebody has to sit down, plow through it, systematize it, and put in a package and make sense of it. So I think the problem with medical community is there's no time to study this, and there's an old way of looking at it. And the old way of looking at it, you have mono, you're done. Number one, you can't have mono again. And number two, any medical conditions after the mono are not related to that mono. Like mono is perceived as an end result, and that's it. But that's not true, because if you look at literature, you have chronic mononucleosis syndrome. And if you look at the symptoms, you can almost match it with chronic fatigue syndrome. And like you mentioned, you have a condition as a kid. One of my patients had idiopathic juvenile rheumatoid arthritis as a kid. She missed half a year of school. That's traumatizing. She was very severely impacted physically by it, over-medicated, misdiagnosed. And then she went to college, had depression, and had mono. Because then, like you said, they anticipate that this is what it is. But then by the late 40s, and I had known her before, but by late 40s, she was almost suicidal. She was heavily depressed. She had all kinds of problems. And so I asked her to immediately test for Hashimoto's and EBV. Both were on. So it's like over the progression of your life, this little virus keeps popping up, demonstrating, showing different presentations. It just keeps going deeper into different organ systems, depending on how you live your life. And of course, in that case, typically of EBV, there was a tremendous amount of personal stress at work, really severe stress at work. That is like chemical avalanche that will feed the virus. So this is kind of how it goes. The people don't realize that there's so many connections. So one of the things I used to tell my new patients is read the book, and next time we talk about your life through the eyes of the virus. And inevitably it's like, oh my gosh, all these events that were unrelated in my medical history and my hiccups and here and there, mystery conditions, now I can track them. This is another layer of this virus. And so in medical literature, researchers say if you have idiopathic condition that doesn't, chronic idiopathic condition that doesn't respond, you don't know where it's coming from, you need to test for chronic activated EBV. There's research that say if you have a patient with chronic illness and you're doing the typical protocol and it's not budging, again, their suggestion is test for chronic EBV, chronic activated or active EBV. So, there is research, and those big mystery conditions, which you and I in our clinical practice work with, right? This is what I realized, that some of the cases that I couldn't help, they were just glaringly in my face, cases of chronic EBV with complications.
So we know it's extraordinarily common. Where does it like to settle in the body?
Are you tired of living with chronic pain? Medication only masks the symptoms, but real healing starts at the cellular level. I'm Dr. William Pollack, the leading expert on PEMF therapy. Pulsed electromagnetic field therapy is a science-backed, drug-free solution that helps reduce pain, speed up recovery, and improve overall health, right from the comfort of your home. Take advantage of an exclusive 10% discount on drpollack.com PEMF systems. Visit drpollack.com, that's drpawluk.com, to register and claim your savings. This limited time offer is available only to registered listeners. Don't miss your chance to experience the benefits. Terms and conditions do apply. Don't just manage pain, transform your health. Visit drpollack.com today, and let's get started on your healing journey together.
Yeah, so it's interesting, and I don't know why, let's say, a large spleen is typical of young boys. Hashimoto is common of middle-aged women. It's not, it's not always like that, but autoimmune hepatitis, the liver, could be younger, could be older. A few people will have encephalitis, Some people will have the virus in the inner ear nerve. Sometimes they go almost deaf. It can get into the eye and almost cause blindness. I mean, I see all kinds of weird presentation. Some cancers, so it depends what kind of cancer. Tumors, it could be.
What's the most common cancer with EBV?
What's that?
What's the most common cancer from EBV?
I think lymphomas, there's 10 or 15% stomach cancer, actually, interestingly. I mean, if you look at literature, 60% IBD, whether it's Crohn's or ulcerative colitis, are attributed to EBV as a causative factor. Not that you can turn it around, because at a certain point it's too late. There's so many other immune disorders that are also connected to EBV, associated with it, or even black and white cause EBV, are caused by EBV.
So you could even have MS.
MS. So there's seven conditions that are directly caused by EBV, according to Dr. Harley's study, and that's from, I think, 3 years ago. It's a new study. MS, diabetes type 1, idiopathic juvenile rheumatoid arthritis. I'm going to miss celiac is a big one. That is a new one. IBD, I mentioned. Diabetes type 1, rheumatoid arthritis, and lupus.
How about pancreatitis?
I don't know. I haven't looked at PubMed. I should.
Well, and the question is whether type 1 diabetes may be activated by EBV.
Type 1, yes, exactly. That's Dr. Harley. There is a specific protein from the virus that gets into the DNA in your cell that is coded for autoimmunity. If you have those genes, you can turn on those genes.
All right, big question. Chronic Lyme disease versus EBV.
Don't know the answer. I have anecdotal stories, and I found a study. I haven't looked for studies recently, but when I looked, I found one study saying that EBV can be misdiagnosed Lyme's, and one study that saying that Lyme disease can be misdiagnosed EBV, depending when you look. I have anecdotal studies when people would try the long-term antibiotic therapy for their Lyme's, and they would deteriorate, because that's really scary. But then they would leave that path and go into a very different protocol that is much closer to antiviral protocols. I talk to people, and that was their recovery. That was the turnaround. So I purposely don't work with Lyme's. If people have Lyme's, I think you have to do something on your own. I just don't want to mix the two.
Well, here's a challenge that I have, because EBV is ubiquitous. If you have EBV in your system, we're going to talk in a second about reactivation. But if you have EBV in your system already,
yeah,
and then you get Lyme disease, you get the actual acute infection from Lyme, you have the bullseye rash, then the infection from the Lyme causes all kinds of havoc with the immune system, right? And then what acute Lyme becomes chronic Lyme. And this is where I've seen people have antibiotics for months and months, IV antibiotics for months and months and months. No benefit.
Correct.
Right? Because they're dealing with the wrong organism. They're dealing with the wrong illness. And EBV is very common.
Yeah, so EBV taps into a couple of levels of a person, the physical level, also the emotional level. So when people are terrified of Lyme's, they have this level of anxiety. And so that's a perfect storm for EBV also to reactivate. When we're stressed out, we don't eat very well. And we have very, very clear studies. If your nutritional status drops, your virus becomes more virulent. Junk food also means NF-kappa B. And NF-kappa B is one of those proteins that the virus likes to use to replicate. So we have direct studies showing this. So it's like mapping out where the person with chronic illness is emotionally, physically, in their kitchen, sleep pattern. All this can affect
and their immune function.
Yes, whether the virus can turn on or not. That, like I said, I had never tested my virus because I didn't need to, until I had to move again and again and again within short periods of time from one house to another because of mold. And then I started to see some of the symptoms that were pretty indicative of EBV, and certainly I had a little bit of it reactivated. It's such an opportunist. So any infection that you have, if it's pretty severe, that's in literature too. It's called transactivation between species. If you have, bad strep infection, or H. pylori is common. a common co-infection with EBV, you can reactivate EBV, and another way around, if you have reactivation of EBV, you can reactivate other pathogens that you may have there.
Do you have a typology of the progression of EBV? You talk about the progression of EBV?
There's some hypotheses. There's one on autoimmunity and how EBV is involved in it, and I have it in the book. I say that I've seen all kinds of patterns and it's mostly women, but I've seen all kinds of patterns. It really depends on life, on stress management, or what happens in people's lives. And really, I think the weakest link, because some people believe that, the organs are according to your age. If you're younger, it's maybe spleen, and maybe then liver, and then eventually thyroid. If it's true, I'm not sure. I haven't seen studies, but then again, I've stopped doing studies after the book. There may be some new ones.
Okay, so let's say that you get the acute infection somewhere along the way, or you inherited it. You were born with it, right? You end up in life with antibodies already.
In birth, yeah, you cancer birth.
So that at some point you got antibodies. Somehow you got antibodies.
Yeah.
Now what happens?
Nothing has to happen.
But you have virus. The virus.
Well, we have millions of them. I think somebody said trillions.
Trillions of viral particles. Do you need the whole virus, or can you have components or DNA?
Components on DNA leaves the blood. So the virus travels in the blood just for a short period of time during lysing. The goal of the virus is to leave the bloodstream and find a condo to live in, whether it's thyroid or spleen or liver. So looking for DNA is not that reliable.
So I saw an article one time that EBV hides out in the lymphocyte.
Yes.
So tell us about that.
That's why one of the major things that I teach people to do is move the lymph, because this is often tonsils. The mouth is the entry. So this is close to the brain, of course. You'll have all this engagement. So for most people, this is painful and large. Sometimes you have tumor growth here that, it starts going. So, while you can't exercise when you have EBV, because that's more oxidative stress and more EBV symptoms, we do rebounding, very gentle, to start moving the lymph drainage massage in some cases. We have, in my program, we have instructions how to do lymph drainage massage. We had a massage therapist retired who mapped it out for us. So that's very important. Lymphocytes, yeah, absolutely. This is where you're going to have so much inflammation and stagnation, and that can really backfire.
So it doesn't have to rely on lymphocytes either, or on the lymph nodes. The spleen, of course, is a major reservoir. The liver is a major reservoir. The lymph nodes are a major reservoir. But it also lives on the lymphocyte. So we're talking about circulating lymphocytes that chronically have EBV.
Mostly will be B cells and T cells.
Okay, well, there you go. But that's lymphocytes.
Yeah, mostly. And interestingly, in Japan, it seems like there's more T cells. And in here, it's more B cells typically. But yeah, it's like we have to live with it, although it likes to be latent. And so I think the more what I see is the more antioxidants we have, the more we can turn them off. But the biggest issue for me is the environmental external issues, like the pollution in the foods, but also just the environmental issues like dioxins in the air. There are things that directly reactivate the virus right there and then. And actually mold is one of them.
And mold is one of them? How about
mold is absolutely one of them. And Wi-Fi technology is one of them.
How about glyphosate?
Glyphosate, I don't see the studies, but I would say not unlikely. But I know for sure if you have a combination of heavy metals, Wi-Fi technology, molds, and dioxins, let's say you have a wood-burning stove or wood-burning fire at home, that's really a bad combination. That's why I reactivated in this house a month after we moved in, because of the residue of the mold that my body was dealing with, but also a smart meter that the house came with. I'm still waiting for it to be removed. And, everything was piled up in one corner of the room, and boom, I developed vertigo. I had never had vertigo in my life. So, I put myself on the protocol. 24 hours later, I was fine, moved my desk. It was fine. So you can when you start to create that holological map in your brain of where the virus likes to fight you, what kind of circumstances you can expect to reactivate it. And if you know the protocols, if you know what to do, you can turn it off within 24, 48 hours. That's my biggest goal for my community. Let's go through the whole education first, all the tools, and then typical factors that reactivate it. So you can expect, and people do what I do, you can feel it coming back. You already know what your symptoms are typically. You feel it coming back, you can zap it. So it's not invincible. It's kind of predictable. And we have medical research, I'm going to quote, it's treatable, reversible, and sometimes even rapidly.
How do we know we have it? How do we test for it?
Yeah, you need 4 antibodies typically, and you don't want to skip any. So you have a context. You want all 4, and then you need a patient's context. Like you need the story.
Which 4?
VCA IgG, VCA IgG, EBNA IgG, and EA IgG.
Say the last one again.
EA IgG.
Okay, EA, early antigen. So what's the relevance of the 4?
The VCA IgM, we don't see it turn on with reinfections. We typically see it in that, like if you look at literature and also what I see, it's more of the first time activation,
which is typical for IgM.
Which is typical for IgM. I've had a handful of cases when it constantly shows up anytime they do the testing. And there's some literature saying that it's molecular mimicry or co-infection, something else going on. But typically it's expected to be normal in the chronic EBV, Typically when people have first mono, they probably will end up at the doctors, and it's pretty obvious that it's the first time or mono. But the chronic one is iffy. So
that's probably the mono spot test, right? It's IgM.
I'm not that familiar with monos actually. I just work with the antibodies.
Okay, so, well, a mono spot test is an antibody test, but I think it's a very quick swab.
I see.
And usually it's kids that come in with the obvious glandular manifestation, and you do the mono spot rather than doing blood testing. You do mono spot, and you can diagnose it right there. So I'm presuming that that's going to be IgM.
I don't know. That's a good question. You see, I don't know everything.
All right. So now you have IgM. Go ahead with the other ones.
So then you have the 2 big ones, VCA-IgG and EBNA-IgG. These are the ones that you have for life, and so they will be elevated if you've had exposure. But if you have triple digit, that's a problem. If you have more than 600 or more than 700 around, that's typically a problem, because that can be 2,000. You don't know, and so then you look, okay, is this person healthy and living their lives? So typically with those numbers, they're not doing well. So these tend to fluctuate a little bit up and down with reactivations. But if you are improving, so they will drop and drop and drop, but they will never go to 0. You always have some of them. And then the 4th one, and this is a tragedy because there are panels that doctors use that only do 3. And they miss this one. And sometimes patients, they're educated, they requested, and even if they requested, sometimes they miss it. So that's a tragedy without this, you really don't know what you're looking at. So early antigen is the one that shows current reactivation. It doesn't have to be very high to be positive, and you have a window of 2-3 weeks to capture it. So when your cells lyse, you don't want to wait. So let's say, because it comes up and down. So let's say I had a student once who told me, I have a classic chronic EBV, but her early antigen was negative. So what do I do with this? So I said, well, when did she test? In January. And so I asked, when was the worst time when she felt like she was hit by a truck? Like when was it? Thanksgiving. I was like, well, good luck to you. So, so if you're really the sickest, that's where it's hardest, but that's where you want to test to see if the early antigen is there. And then with the antibodies, there's some irregularities, like a percentage, 10-15% do not manufacture one of these antibodies. And sometimes people have 0. There's like clean slate. There's only one lab that I'm aware of that tests EBNA IgM. And so with that person, I tested that lab. So I had the fifth antibody, and that was the only one that was elevated. So we would have missed it. But if I would say if you do the four with the panel and it's all completely clean, then I would test total immunoglobulins, IgG, IgM, IgA, and then recalculate with a calculator. Okay, if this is the range and this is so long, what would it be if she was making them? So that's kind of the story. But I would say
your body was designed to heal, but illness, chronic disease, stress, injury, and time can slow that process down. What if you could restore your body's natural ability to recover, recharge, and feel its best? The key to healing is giving your body the energy to repair itself. PEMF therapy does exactly that. Recharging your cells, improving circulation, reducing inflammation, and helping you function at your best. For decades, I've studied this technology, worked with hundreds of medical professionals, and helped thousands of people reduce pain, regain energy, and take control of their health. However, not all PEMF devices are created equal. No one size fits all. We offer personalized consultations so you can find the right device for your needs, backed by real science and trusted results. If you're ready for a real solution, let's talk. Schedule a consultation at drpawluk.com. That's drpawluk.com, because real healing starts at the cellular level.
You never like, you're the doctor, the saying, you don't treat the lab, you treat the patient. So there's always that context. And the context is like, I think my book helps people because they see the context of where and how this virus can manifest, and their stories of patients. And so that becomes rather than, so they can make connections about their life story and the journey where that virus was actually already impacting their health. And it's pretty empowering. Because, these are the people, like you remember, that are so anxious about their health because they've been through the ringer. They have millions of diagnoses. They're afraid of another autoimmune condition, like stacking up. And so if there's even EBV on the horizon, then they're scared of cancer.
Right.
So it's really important to see the context of the story and give people help, saying it's just a virus. It can turn on, but it's predictable. We can turn it off. There's tools. It's not true that you can't get rid of it. It's not true that you can live like that. None of that is true. It's possible to turn it around. That's the best part of it.
Now, I routinely recommend immunoglobulin testing. If you have somebody with chronic conditions, chronic fatigue especially, but just general chronic conditions, you have to always think that there's a problem with this immune system. And so in addition to doing the EBV antibody levels, I will do other viruses too, right? Because they can be there. HHV6, CMV are very common co-riders, right, with EBV. So if you do a full panel, you really should do a full immunoglobulin panel as well. Because if you have low IgM levels or low IgG levels, even though you're positive with IgG for EBNA or BCA, you could still have low general levels, which means that you're basically, in some ways, a sitting duck as well.
Right. That's true.
So let's talk about, you said you can kill the virus. What are the conventional medical therapies for?
We can turn it off. I don't really kill it, and I don't like this vocabulary because killing causes so much toxic debris. Like a monolaurin or loracidin, that kills the envelope, and that is a problem because you create a havoc on the compromised already body.
I'll repeat that, loracidin and monolaurin.
Yeah, we don't use it in the protocol. I only resort to it if we have co-infections like chronic overgrowth of Candida or H. pylori, because they deliver. So if that's worth it, but we have to be careful. I have it all explained in the book because a lot of people don't tolerate it. You have to be very careful with dosing. It can tip you over and create a havoc with die-off. It's dangerous for a person who's so sick.
What about the standard medical therapies?
Well, medical literature says low efficacy. The doctors that I've trained, I asked them, don't work. And then the community of people that are coming to me didn't get better on it. So kind of consistent, 95%, I would say there's 5% that can swear by it, but that's not good enough.
But why? Why don't they work?
I think, if you have one target, one pathway in which pharmaceutical targets a virus, it's not enough. I think the value in the protocol I devised is we hit the virus in different ways with different nutrients. And at the same time, we multitask with those nutrients. They are high antioxidants, which the virus hates. They are highly anti-EBV, antiviral, and they are nutrients. So they actually start boosting your immune cells even. Immune cells also need basic nutrients. And there are certain things that the virus targets, targets mitochondria, you need maybe more magnesium. When you target it this way and look at the environmental, input, you don't inhale fireworks, you don't inhale the fire, burning forest. When you start orienting yourself and you have the right tools, it's very different from one medication. It just can't do it. It's just not possible for one medication to do that when the virus is so insidious.
Well, in fact, actually, that's an important point, because what we see with Hep C and what we see with HIV is that we have cocktails of antivirals, and those antivirals are virucidal. What's the most common antiviral people use for EBV?
Non-medication, you mean?
The medication.
Medications are not my forte.
Okay. But there is the most common medication, the same one that we use for shingles. It's not virucidal. It's virustatic. Just like we have virucidal or bactericidal antibiotics for bacteria, we have bacteriostatic antibiotics for bacteria.
Oh, that's interesting.
So all the bacteriostatics do is they stop the progression of the growth of the bacteria. They don't kill the bacteria. They stop it from multiplying, right? And we do the same thing with shingle virus.
The shingles,
right?
Yeah.
Ribavirin. So what happens then is that we don't have virucidals. We're not killing the virus. All we're doing is suppressing the growth of it. So you're not going to be able to deal with, if you have an active escape of the virus and it's growing rapidly, then a common virucidal can potentially help somewhat, but it's not going to finish the job.
Right, because they're just gonna, whatever you don't kill, they're just going to travel into your cells. And
it can become even more chronic. It become buried even more.
Right, buried in the cells. Yeah. Yeah.
So talk more about your protocol. What's your favorite protocol? What do you recommend as a baseline? I know it's in your book, but let's talk about it.
So if it's just EBV, it's pretty straightforward. If you add those components of your life plus the supplements, diet, sleep, and stress and all that, and environmental toxins. What is an issue is that it often comes in a bucket with friends. So there's complications. And so really, in order to understand how much of what happens to the person that has chronic issues, how much of it is EBV, I created a preliminary protocol, and we focus on that alone in the first 3-4 weeks. It's heavy duty, it's aggressive, it's 7 supplements plus vitamin D, that goes without saying. And we watch because it's predictable, it's evidence-based, it works, it's pretty aggressive. So you start seeing some things starting to shift and the needle starts to move. So people are more stable, less brain fog, less fatigue, start thinking properly. Sometimes people ask me, is there a placebo effect? Because I can't be feeling so much better so fast. So it's like expected that this will deliver. And if it doesn't, like if you are on it for 2-3 months and you only like 50% better, 40% better, then we look deeper. Like we look, okay, where is that mold? Or what else is going on? Yeah, so we have these layers. That's how I designed the program. So we can learn once about your life and your body. So the initial protocol, we call it the EBV Jumpstart Bundle. You have aggressive doses of NAC, selenium, lysine. You have some zinc, vitamin E, vitamin C. And the only herbal botanical that I use at that point is licorice, if people can handle it. And so, but we have aggressive doses, like selenium, we drive it up to 800 micrograms, depending. And, NAC is safe, medically safe, up to 4,500. We don't go quite as high, but I want to push it. And so, people with chronic EBV sometimes have multiple sensitivities to any supplements. And sometimes it takes them a while to take 1, 2 capsules, 3 capsules, build it up to the highest that they can tolerate. And so we stack it up once you have that, and then you run it for 3 weeks, then you start seeing things happen. And then we built up a fuller protocol, and we add the diet, we add all kinds of components, and then so that's pretty straightforward. And really, it's just evidence-based. And then I kept tweaking it in my practice and saw consistent progress and recovery. So it's a robust process because you want to look at environmental toxins, you want to look at the air quality, the water quality, EMF. You have to learn these things. I mean, that's such an opportunist.
Do you add these other factors after you start your initial protocol, or do you try to do as much as you can at the beginning?
I do a little EMF challenge. I have like a bullet of 10 things to turn down the volume on Wi-Fi that is simple for people, just to, it's like, where do you start? We have such an unhealthy lifestyle. Where do you start? But the people that at least come to me, they've tried everything, like, not for the lack of trying. So they're really motivated and they do the work. And when they do the work, they can really create a life. And then I support them with spiritual growth and more tapping into the joy, moving them towards a life that is meaningful, has powerful service to this planet, so people are really fulfilled. It's not just about getting healthy physically. That's not what I do. Like, that's like the surface part, but the secret is really to move people to the spiritual empowerment and finding the dreams and following them and being of service.
And those are fundamentals. So
Yep.
what's your thinking about PEMFs? Since this is a PEMF summit.
Yeah, I don't know much about it. I don't use it. I don't think I've used it. Some of my students will experiment with different therapies like that and ask me questions. I think it has so many opportunities. I just haven't had the tools, so I haven't physically tried them. I used to see your machine. You had some tools in the clinic, remember?
Right.
Way back then, but I never used it on me. So
let's put it into context. We don't know whether PEMFs will virus or not. And PEMFs are basically supportive to the whole body in general.
Right.
So but one of the most important things that PEMFs do in conjunction with whatever else you're doing is if you can make, and the same thing applies to Wi-Fi. You can't necessarily get rid of all this stuff, but what you do is you make the body healthier and the body becomes more resistant.
Yeah.
So if you can increase ATP in the cells, if you decrease inflammation in the body in general, right, then the opportunists don't have a garden to grow in.
It's the terrain. Yeah. So it's a little bit like vibrational frequency?
Not necessarily. So what happens, you can configure PEMFs that way, but most of my perspective is based on the fact that what you're trying to do is to increase the energy in the cell. If you increase the energy in the cell has more vitality. If the cell has more vitality, it's more resistant. So not only is it more resistant, but it also becomes more regenerative.
So that would definitely work for somebody with chronic EBV. Definitely.
I would think so. With not only with chronic EBV, but basically almost any chronic illness.
Chronic illness, yes.
Right. And EBV being the biggest opportunist. So anybody doing a lot of EBV work, and I would say that probably in your population, if they've tried what you do and they're still struggling and they're still relapsing or going back and forth, then they probably need to add something in the background that basically supports the whole body.
Create a different baseline for the cells. Yeah, absolutely.
And it helps the cells actually to absorb and use nutrients better.
That's perfect, because that's the answer right there for EBV.
Right, it does so PEMF do so many things, and in my books, Supercharge Your Health with PEMF Therapy, we talk about adding PEMF therapy to other protocols. PEMFs don't work entirely on their own. They need that nutritional support. They need all the other lifestyle factors that you need to be healthy.
Yeah.
Right? You can't be pouring gasoline on the fire, as I say, and then do magnetic field therapy hoping that it's going to put out the fire.
Right. It's in the context, but it's a beautiful adjunct. So definitely. So I do need to read your book.
I think you do. Well, we'll have to make sure that you get it.
I do have it, and I will read it because it would be amazing for our community. Definitely.
I would like to hear some really good reports from your community and using it.
They're pretty vocal. Yeah, I would like to test it too. Absolutely.
We'll have to talk about it.
So we have to talk about it.
I know you have to go. I know you have another appointment. Do you have any parting thoughts or comments or suggestions?
Very ironic statement that I've heard before from our community is that in some cases EBV is the biggest teacher, because basically if you have balanced body, spirit, body, physiologically, physically, mentally, emotionally. It's very hard for that virus to do the damage, to lies, to trickle into medical conditions. And so in a way, we have so much toxicity. We are so out of sync with our dreams, who we are, what we represent, the relationships we have, the jobs we have. 80% of people in the States hate their jobs. That's awful. Designed to do what we love, be in full integrity, and be of service. So, I think, and we have so much toxicity. So all these layers, and EMF now, and mold now because of how we build the houses. So we are pretty insulted. And I think when people tell me it was my biggest teacher, it's a hard pill to swallow for somebody who has chronic EBV right now, because it's so tragic, it's disabling. But in a way, if you can get over it, it means that you take the journey of self-love ultimately. And there's things that need to be changed because of our environment, because of our lifestyle that is not sustainable. So that would be my message, a message of hope, and the fact that it's, we get so many resources. You can start on the journey, you can get better, and you have, your resources are amazing as an adjunct. That would be just fantastic. Also self-love, just self-love. You pick it, you use it because you're worth it. And then just addressing what's not synchronized with who you are in your life. Can you step in and show up for yourself and say, this is what I need to do?
That's another factor. It's like bad nutrition. So bad ideas, bad feelings, right?
Thoughts come from nutrients too. When we are stressed, we eat poorly. That's just physiology. You have different chemicals screaming sugar and
the quick fix, right?
Yeah. That's just, it's a difficult time we live in, the human species. It's very demanding. And we don't have a tribe, we don't have support, so especially for women. So something has to give, and I think the virus is a good indication that that's happening in somebody's life. But
well, that's what we're seeing through this summit. There are many ways that you can become activated. There are many ways, like cancer, for example, or autoimmune diseases.
Right.
There are many ways of becoming activated. Once you become activated, then you have to step outside the conventional medical system, because its job is very limited, and you're not going to become self-actualized. You're not going to become sort of independent in your own ability to take care of yourself, relying on that system. Now, it has its place, of course, right?
Yeah.
But once you become activated with anything, including EBV, then you have to start on that journey.
Yeah, it's a journey, definitely. Better get ready.
Well, we're getting ready, and thanks to you, we're going to be able to move down that road much better.
Oh my gosh, your work is amazing. I'm just honored to be here.
Well, thank you for being here, and I'm honored as well. It's great to see you again, clearly.
Thanks for joining me on the PEMF Effect. I hope today's conversation gave you new tools, insights, and inspiration to take control of your health. If you enjoyed this episode, don't forget to subscribe, leave a review, and share it with someone who could benefit from PEMF therapy and holistic healing. Your body has the power to repair, recover, and thrive. Sometimes it just needs the right charge. Until next time, stay curious, stay proactive, and keep powering up to better health.